do it again. Look how pretty. We have a nice little heart here. This is the right auricle that is on top of the right atrium. Here's the left auricle or ear flap that goes over the left atrium. Okay? So now, blood is going to enter into the heart from the right atria. It's going to enter into the vena cava, one of these, like that. Okay? It'll enter into the atria from the vena cava and enter into the right atria. Once it enters into the right atria, it's going to pass this valve called the tricuspid valve, which is also an atrioventricular valve that connects the right atria to the right ventricle. Okay? Once blood goes past the atrioventricular valve or the tricuspid valve, it'll enter into the right ventricle, where it will make a turn right here and go through this structure up past one valve called the pulmonary valve and exit the pulmonary artery. This is the pulmonary trunk. This pulmonary artery is now going to go to the lungs. It'll go to the right and the left lungs and cycle around, releasing CO2, absorbing oxygen. Then, once it's done with the lungs, it'll return back to the heart into a structure called the pulmonary veins, into the left atria and enter into the left atria. Once it enters the left atria, it will pass another valve. Here's a piece of blood. It'll enter another valve, an atrioventricular valve called the mitral valve, which connects the left atria to the left ventricle. Blood will fill in to the left ventricle and make a turn and come back up and travel along this and past this valve, which is also a semilunar valve. This is called the aortic valve, into the aortic arch. Once it gets into the aortic arch, it's going to go a couple of different places. One, it's going to go into the trunk, but the trunk is actually going to split. One part is going to come through here, which is the brachiocephalic, and the other part is going to go through here, which is the aortic arch. From the aortic arch, it will split again to the subclavians and stuff like that, and become systemically distributed throughout the body arterially. It'll filter all its nutrients, all its stuff, through arterial circulation into the capillary beds that diffuse out all the nutrients into all the muscle tissue. All the waste and the lymph and all of that is going to be secreted and be absorbed by the capillary bed in the venous side. And that venous side is going to take it through the inferior and the superior vena cavas, where it will be recycled back into the right atria again. So from the right atria, cycles the lungs, to the left atria is pulmonary circulation. Once it goes from the left atria systemically to the right atria is systemic blood. This structure right here down the center, as you can see, this big white muscle layer, if I open this up, you're going to see that it's separating the right and the left ventricles. This is where the interventricular septum is, right there. Okay. The difference between the right and the left that you know of is because the right side has a thin-walled membrane here, the myocardium. The left ventricle has thick wall because it needs to push. It's a lot easier to push blood to the lungs than it is systemically. So the contraction of the myometrium needs to be stronger on the left side because of arterial pressure. So we need to pump it really hard to push that blood so it can go systemically through, because it is that pressure that actually pushes through the capillary beds, allows the diffusion to happen and the absorption back into the venous system, because there is no pump to push the venous blood back. It's arterial pressure that pushes forward. And then when it pulls it in on the right side, there's very little suction that happens. So we need a strong arterial pressure from the left ventricle to push blood throughout the whole system. And that's diastolic. That's systolic. Yes. Diastolic is the resting potential of the heart, is the resting pressure of the heart and vessels, and systolic is the contraction of the myocardium.